Oops, I forgot to unmute my microphone. Ladies and gentlemen, my name is Wayne Harrell, and welcome to the Anxious Podcast. In this episode, we'll explore what is illness anxiety disorder, specifically health anxiety, because we've been doing research on this at our company along with our therapist for some time, exploring different types of treatment options and how it works and more. And a lot of people have been asking different kinds of questions regarding health anxiety, like, I have this symptom. Is this health anxiety? What is it that triggers health anxiety? Could my doctor be making my health anxiety worse? What can I do? And it is really important for us to tackle this right now because there are a lot of people who are just straight up not getting medical help because they're afraid that the doctor is just going to give them the bad news that they expect and everything is going to go to hell. Or some people just go to doctor again and again, way too many times, creating a burden on our healthcare system and more. So in this episode, we will discuss what is it and what can you do about it, right? There are cases where we've heard the doctors making health anxiety worse, and there are cases where doctors know how to handle health anxiety and things work out for people. So in this episode, we will discuss a little bit more about that and what you can do about it. Now, health anxiety is simply a fear of catching some illness that's going to ruin your life according to your mind, despite medical reassurance. You don't really have to have any symptoms to experience health anxiety. In fact, many people don't have any symptoms at all. Sometimes people just read something about something online and they just think that they might probably have it. So they start over focusing on a particular part of their body. And of course, they will feel something because you're hyper focusing on a certain thing. And they start to spiral. This is very common with people who have heart anxiety because it's very easy to experience heart-related symptoms. If you're extremely anxious, stressed, sleep deprived, or your routine is not good, your heart rate can go up and down, your blood pressure can go up and down, and if you hyper focus on it, you can develop health anxiety. According to NIH, almost 2% of people have health anxiety. But I think the number is a little bit higher than that because a lot of people just straight up do not report that to their doctors, or it just doesn't get logged into their file. So I think the report is quite high, especially when it comes to men. Men often don't really get treatment for this or talk about this. Women often go out and seek help, which is one of the reasons why 80% of our audience is women. And that's great. If you have health anxiety, or if you know somebody who have health anxiety, they should get help. This is a serious medical issue, right? Because it's going to interfere with your ability to live your life more freely, more openly. And so you have to get help if you have health anxiety, and we're here to give you that help. So let's talk a little bit more about it in detail. Before we begin, this is not a medical advice. If you have any kind of symptom or anything that's getting worse or something new, go and seek help from a registered medical practitioner. This is not an alternative to any of that stuff. My lawyers have told me again and again to say this on almost every single episode. All right, let's begin. Now, here is the key difference. You see, illness anxiety disorder, not all of them are same. Sometimes you might be sick with something and you just went to a doctor and you're having anxiety about the test results, right? That is normal. That is not illness anxiety disorder. That is just, normal anxiety about your health. Health anxiety or illness anxiety disorder that's classified in DSM is specifically when you're worried about your health despite medical reassurance, right? So that would be you worried about, your health, even if you don't have any symptoms, as I've said before. So previously we've talked about lymph node anxiety, right? Like maybe you have like a swollen lymph node and it's palpable, it's visible. So you go to a doctor and he say, hey, it doesn't look like something serious, and you'd be like, oh, come, but it's popping out literally. And of course, that is health anxiety, right? But in many cases, people just don't have anything, right? Like they don't have any lymph node poking out. They don't have any symptoms, just normal, elevated heart rate here and there. And if you have it chronically, that is illness anxiety disorder. Um, my sister had it, like she was like worried about her health. She had no symptoms at all. Like she perfectly healthy, not overweight, no nothing. Perfect, clean bill of health. But she was always worried about it, right? And that has a lot to do with people seeking information online, watching, social media, reels and TikToks and shit like that, and people talking about all kinds of shit that went wrong, reading comments on social media about people talking about different kinds of symptoms, like, hey, I just had a stomach ache for like, I don't know, 1 week, turned out to be cancer. Stomach ache is normal. I mean, everybody at some point has stomach ache. I have a stomach ache once every month, right? Depends on what I eat. Well, with people with illness anxiety disorder, that is not a good thing. That will trigger them. And a lot of people listening to this podcast probably would be able to relate, right? It's very debilitating. It can ruin your life because you're not able to focus on other meaningful things that are happening in your life. So, yeah, and we should never stigmatize this. This is normal. It happens, right? But we would want to separate, regular anxiety about your test results. You're waiting for something because you're worried, hey, my insurance might not be able to cover this in case if I develop something serious. I'm a little bit nervous about this. Got to be honest. Versus, anxiety, illness anxiety disorder, where you're anxious about when you don't even have any symptoms, right? Because you read about it something online, or you are anxious because you're anxious. Oftentimes, people who do have illness anxiety disorder would hyper focus on a particular body part, as I've said before, right? And of course, when you do that, you'll feel a sensation. You might go for a walk or climb a flight of stairs, and your heart would start racing, and that would, start a panic because you think you might be having a heart attack because your heart rate is just jacking up. It's putting you at a risk of stroke or this or that and all kinds of things that goes into your mind, and it starts to loop. You're not able to focus. It just keeps going on, and then you go online on some of these forums and Reddit or Facebook groups and ask people about different things, and they reassure you. You feel a little bit better, but then it happens again, so you go back to them for reassurance again and again and again, and it just continues, right? This is also called somatic anxiety. Somatic means just something having to do with your body, right? Like anything that has to do with your body is like somatic. So, in conclusion, normal worry is temporary. It goes away, right? You go to a doctor, he tells you everything is fine, you go home, and it's over. Illness anxiety disorder is not temporary. It lingers on and on. You go out, you seek reassurance again and again and again. And honestly, folks, the treatment for this, I think the medical community has dropped the ball on this, because they're providing reassurance again and again, and even the therapists are not taking people who have illness anxiety disorder seriously. So the treatment quality is quite bad. It's getting better though. So yeah, you just have to find a right therapist, and this is not an alternative to therapy, but you reach out to us, and one of our therapists or a therapy coach can draft a plan for you that you can practice at home using QuickCalm. So that would be, a helpful resource if you're not able to get into a therapy or your therapist is not really good. Okay, moving on. So now that we know what illness anxiety disorder is, what are the core symptoms? Well, the core symptoms is constant fear of illness, frequent body checking, and reassurance-seeking behaviors like online searches, going to Facebook groups, Reddit, here and there, asking, hey, this is normal. Is this normal? Is that thing looks normal to you? Is this has this happened to anybody? What does this mean? Right? And people posting their own like health checks because they're getting health checkups done from these third party labs and posting them online so strangers can look at it and maybe find something that their doctor missed, right? On and on, all kinds of things. Physical emotional signs are like anxiety, panic attacks, avoidance of medical information. As I've said before, like one of my uncles would not see a doctor regardless of what's going on in his body, right? Because he's afraid that, hey, let's just not do it. Let's not get an annual physical because he might find something like, I don't know, stomach cancer or some shit, and it's going to ruin my life. I just don't have time to deal with this fucking worry right now. I apologize for swearing. It's just a habit. So yeah, but in most cases people obsess with health news. They would obsess with different kinds of information outlets out there about health news, right? And it impacts on their daily life, right? It can lead to social isolation, work related issues, strained relationships, because they're unable to focus on their relationships and they're focusing on, excessive worry about something that doesn't even warrant worry, right? There's also a variation here. Some people focus on specific illnesses like cancers and heart attacks, while others have general fears. For example, when I had health anxiety all those years ago, I was worried about all kinds of things. Like, for example, I was worried as a 18-year-old boy that I had some kind of a vascular illness, or maybe I have an embolism. Embolism, not embolism. Sorry, folks, English is not my first language. Yeah, embolism going in my leg, right? Or that I might die from this, or my condition might get worse and I might end up losing my leg and I won't be able to walk. Now, keep in mind, I'm an 18-year-old healthy guy who works out, right? So, yeah. So what causes this, right? Like, how does this originate? Um, Now, if you go and look at the literature online, they will say, oh, it's not really fully understood. But genetics play a role here, childhood experiences, like, for example, some serious illness in your family, if you have a loved one who died from something or suffered through something, and you lived with that person, you're like, I do not want to, go out like this guy. It was just brutal, right? Especially people with cancer. I remember watching that 9/11 hearing where that guy who went through 69 chemos, he was called in front of Congress because they were not giving money to these people who risked their lives. And he came. You can look at his video on the internet. He came to in front of the Congress, and he looked like death. He looked like he was decaying, all yellow, dark, rusty, and skinny. Young guy, right? He was barely able to talk. And if you see somebody like that in your house, somebody you love, yeah, that is going to cause trauma, right? And then there are also personality traits like perfectionism, right? You want absolute perfectionism. You cannot tolerate any amount of uncertainty in your life, right? There are other things too, like sometimes doctors are known to cause health anxiety by having poor bedside manners, right? They can often, give you information in a way that is not properly digestible to normal people. So yeah, and when you go through any of these things, usually there is a trigger, right? And that trigger, like some kind of a stressful event or access to some health information online or misinterpreting any not normal bodily changes or As I've said before, you go to a doctor, and if he was just like even slightly wrong, which happens rarely, but it does happen, or he um, doesn't give you the right information, or it doesn't treat you well, it can trigger, because now you're like, I can't trust my doctors anymore. What's going on? Those things often trigger anxiety, or specifically illness anxiety disorder. All right, so let's move on to the next section, which is how does your therapist or a doctor diagnose you? Because you would want to get diagnosed in a way where your insurance is actually covering it. So the way DSM-5 described this is you need to have the symptoms that I've mentioned for at least 6 months with no medical explanation. And if you do have medical symptoms, they have to be unrelated to the illness that you're afraid of. Okay, so you have to have it for 6 months, and that's how they diagnose you, right? And then you can go into therapy, and your doctor can probably prescribe you certain medication for this. Although most of the psychiatrists these days avoid doing that because they've gotten in a bunch of trouble because they're just prescribing medication without therapy, which is not really good. And once you do that, your insurance should be able to cover this for you. The challenges here is your provider is much more likely to misdiagnose you as other types of anxiety, right? Because as I've said, illness anxiety disorder is different from other anxiety disorders. So while they do sound same, the treatment for them is significantly different. At least from a therapy point of view, I would say. So yeah, and but eventually when you go talk to a doctor, you seek therapy, or you talk to an expert, they will diagnose you correctly. So just keep at it, right? Don't give up. And if your health worry interferes with your life, as I've said before, uh, and it persists despite you seeing doctors about it multiple times, then you should seek help. All right. So yeah. And other than that, right, we at The Anxious do help people who have illness anxiety disorder or health anxiety in general. And we have a program, so you can schedule a call with one of our coaches, one of our therapists, depends on who's available. And we can design a program for you that you can follow using QuickCalm app and other tools. So every week you'll get 2 calls. One is where we deliver you the tools. You follow those tools, these exercises, and all those things, and then there's a Q&A session that happens. And this is one-on-one for every individual. And then you plug those exercises into QuickCalm app, and all that data you can share with your provider, and it works, right? And it's a 90-day program, and it's one of the fastest way to heal yourself outside of therapy. Actually, therapy takes a lot longer, because I think therapy would take you 6 to 7 months, and you have to be receptive, and you have to follow other things like meditation, mindfulness, and yes, medication as well. So with therapy, with our program, you don't really have to do those things, but it would be nice if you can. So yeah. Okay. So now how does the treatment for this works in a professional setting? So you would go to a therapist, he would deliver CBT, the same kind of thing that we would deliver with our app, ERP, CBT, and other things, but this would be in a clinical settings. Ours is not in a clinical settings because it's delivered via calls and some digital tools that we do have, right? And basically the goal of these therapies, the goal of CBT and ERP in this situation is to avoid reassurance, is to avoid avoidance, right? So you avoid reassurance seeking, and you also avoid avoidance. Usually means you're not seeking healthcare, or you're avoiding your doctor because you're afraid, or you're avoiding certain things because you're afraid. You're avoiding checking something about your body because you're afraid. What would that mean? Or it would reveal something scary, right? So The next thing is a psychiatrist would write you medications like SSRIs, fluoxetine, or other things. Sometimes people even recommend things like Atarax, Atarax, Atarax. Um, it doesn't really work in my opinion. Uh, Fluoxetine does work. There are other medications your psychiatrist might write. It takes time for you to see effects of that, like especially SSRIs. It would take you about a month, probably even more than a month, because it takes time for it to affect your it fix your chemical imbalances and other things, and so on and so forth. Mindfulness based therapies, these are the therapies that we do deliver in a non-clinical settings at the anxious. So we can help you if you'd like us to deliver you these kinds of tools. So mindfulness based tools and exposure therapy or group support, and then holistic changes like exercises. But usually you would want to combine these things with the professional care, and that helps a lot, right? So yeah. So what can you do about this right now? Well, of basic things that you can do is, first of all, accept that you have illness anxiety disorder or health anxiety, right? Acceptance is the um, first step. Okay, I have this. Now, what do we do about this? Once you do have this, you label your anxiety as such. It's much easier for you to deal with it because you've given shape and form to your anxiety, right? So now the demon is revealed. So now you can fight that demon, right? So daily coping things like basic stuff, right? You probably already know: limiting internet searches, blocking TikTok, or not following health related TikTok accounts. Same goes with I would say YouTube or Instagram, because people would scare the living shit out of you on these platforms. They will trigger you, right? And also, I would recommend to get out of some of these groups that are in the business of providing reassurance to people. It's not that easy, but you have to be able to be willing to accept help. And to be able to accept help, you have to get rid of some of these groups that just do nothing but provide reassurance, right? The other things is the other thing is talk to a trusted friend, family. Reach out to us. We can help you. You reach out to some of the members in the anxious forums. We can help you over there as well. We can recommend different types of tools that you can use that we've created for our members. That would help, right? And in terms of long-term management, just monitor your triggers. Sets what exactly triggers your health anxiety? Just write those things down in a diary, right? And make sure you don't lose that diary. Label things properly, the date and time, what happened, what you were feeling. You can do that in Quick Calm app as well. So that helps. Maintain the program, the De-Anxious program that I've recommend for you guys, the Quick Calm Super program, especially if you have health anxiety. Keep following up on the tools, keep using the tools, talk to our experts. The last thing that I would recommend that helps a lot is journaling, right? Sometimes just sharing letters with other people would help a lot, and anonymously, of course. You can do that in our members area as well. You can share your story with other people. We're working on creating a platform where you can publish anonymous letters to everybody in the world, and we'll distribute it in forms of books, in forms of an online searchable database kind of like thing, so people can search and they can relate to your story. And it would help you a lot in terms of venting things out, because talking helps. Talking with strangers help because it kind of convinces you that, hey, you're not alone in this. It has happened to a lot of people, right? So yeah. And lastly, the word of advice to medical community. Many of the doctors might label this as, oh, this guy's just seeking attention, right? Especially when women complain about this. And it has caused a lot of harm to women as well, especially when it comes to prescribing pain medications for women because doctors often label them as, oh, they're just seeking attention or whatever. That is not really true. This is genuine fear. Illness, anxiety disorder is genuine fear, right? So just addressing the stigma around mental health and hypochondria is kind of important, right? This has like doubled or tripled in instances after pandemic. People have developed illness, anxiety disorder quite often, especially when they see online stories about people suffering from long COVID or related anxiety. And yeah, like women often suffers through long COVID a lot more than men because they have stronger immune system. So immune system tends to attack itself, or sometimes it attacks the virus, but it never stops attacking, and it just keeps on going and going and going and going, and it turns into um, it turns into something much more painful, much more long term, and people often crash out from that. So yeah, those are just a few things about illness, anxiety disorder. Again, if you need help with this, you can reach out to us and we can help you. We can put together a plan for you. Just get on a call with one of our experts and they'll be able to know more about your particular situation and create a plan that you can follow through with, that will help you in long run. All right, so that is it for today. And look, recovery is possible. Managing health anxiety leads to a fuller life. And you can do this. Trust me, I have too. And so have many others. All right, see you in the next one. Take it easy.